Hello and welcome to the featured discussion for 15 July 2021. My name is Harsh Singh and this featured discussion is about ethics and governance of artificial intelligence in the health sector in specific. Now, this is the era of automation, and automation is also happening in health domain. Automation through the help of robots, through data interpretation and prediction of data is the order of the day. And therefore, what we need today is certain ethical norms, certain ethical measures and laws which can actually define the fine line between what must be automated and what must be under human control, what must be taken as private data and what must be used in public utility, what kind of data is generated by these kind of machines, and how much of delegation of work should be done through automation. And therefore this article presents the discussion on the same in the context of corona pandemic. Right now, in this article, what we will discuss is one, the present role artificial intelligence plays in the health sector, the kind of the present role. The second is the kind of ethical challenges and governance challenge these robots are facing as of date, and three, the ethical principles that must be followed so that such kind of division, such kind of dichotomy is avoided. Right, so this article is not only related from government's health perspective but also from ethics perspective. Right, so let us begin the discussion. Now, firstly, there is a humongous amount of role that automation robots are playing in case of the health sector. There are three important ways in which these automated devices are playing a role in our lives. First is the individual based treatment. Now, using these kind of automated devices, robots, these computer based animations and graphs, one understands the level of biomarkers in the body. For example, if our blood biomarkers, so biomarkers are those particular entities present in blood, present in the body. Now, the presence of these can mark the presence of a disease, right, or an indication. Now, if our body is studied and presently we have say 2 amount of biomarkers, a specific biomarker, and later it increases to 5, so that means the biomarker has increased in the body. And this is how a graph is plotted by these machines, and they tell if the individual will possibly get the disease in future or not. So this is called as prognosis of the disease. This is being used by these automated devices to guide immunotherapy, to guide studies in oncology that relates to cancer and treatment. Right, so this is how it is being used in case of individual treatment. In case of research and development, imagine how corona has been fought in such a shorter duration, because one could study, the science could study the impact of corona, the nature of coronavirus, right? Also in case of the gene study, right, the whole gene study, genome sequence is being done through the help of these automated technologies. What they do is they map the gene sequence, and this is how every individual genes are marked and they are studied. All right, so this is how research and development is being carried with the help of the automated technologies. The third is public health. Now, imagine how this outbreak happened so suddenly throughout the world, and the quick response all around the world. How did we come to know about social distancing norms? How did we understand that we have to wear masks and clean our hands? What is the rate at which virus dies and progresses, whether coronavirus is airborne or not? How did we understand? This is all through automated data that was transferred and later studied and analyzed. It was also predicted how corona second pandemic, third pandemic will progress. So this all happened through the automated technologies aided by artificial intelligence and robotics, right? So through this, one could also micro target the areas in which more population is there, in which there is more vulnerability to corona pandemic. So artificial intelligence actually is helping us to understand the transmission, right, detection, possible vaccines and treatment of it. Holistic way of treatment is being aided through the help of technology. So we cannot refute how technology is aiding us in this sector, right? But we should understand that there are boundaries, and this is where the challenges will come, right? There are certain boundaries under which this operation must exist, right? Operation of the automated technologies. So first thing is, can we think of technology as replacing humans? For example, if I am present in front of a psychologist, will the psychologist give an individualistic treatment to me, or will a machine be able to give an individualistic treatment to me? Of course, the individualistic treatment, the personalized based treatment is only done through humans. So we have to understand that technology does not provide the solution to all the problems, that human face, right? So humans are irreplaceable. That is the first thing. This should not be attempted, that technology and machines replace everything, that machines are intelligent and they can make decisions on behalf of humans everywhere. So first thing is this is the first challenge. The second one is very simple: digital divide. Now, because all this technology is being used with the help of digital medium, therefore a lot of population, especially in the developing countries, underdeveloped countries, will be out of reach. So digital divide is another challenge. Now, third one is data collection and data usage, credibility of data. Now, if we have a wrong data reported and another wrong data reported and another wrong data reported, this is only going to lead to faults in the conclusion, to faults in the inferences, to fault in the predictions, right? So this is another issue with the data. Also, most important is data colonialism, right? Not everybody has the data about the technology. Also, what about the consent privacy of the data, right? These days data is being taken and it can be even invaded from personal usage, and privacy of many people is at stake. So these are important concerns that are raised. And what about the replacement of humans in employment sector, in employment in the health sector, right? So these are important challenges that must be addressed while replacing human technology with automated technology, right? So you have to place all these 5 points, 4 and data privacy, these points in your answer, and then it becomes rich in content, right, about the challenges. Now there's something called as Uberization. So Uberization refers to commodification of health services, right? So that is something that can be streamlined, and a fine balance must be maintained of how much to make it commodified and how much to make it personalized and human based, right? Now, therefore, to maintain this balance, one must have a framework to operate with. Now, this framework should contain ethical principles and laws, right? Some laws where human benefit also is at the center of it, right? So, first of all, artificial intelligence must be seen under the purview of human rights. So Toronto Declaration talk about impact of AI on human rights. Now prelims centered Toronto Declaration, right? Another declaration that we have is on Astana Declaration, that is on use of digital technology. So do remember these two declarations, Astana Declaration and Toronto Declaration, right? We must have data protection norms, just like European Union has this stronger general data protection regulation, right? So these are some norms which have been already put in place and they must be followed in health sector as well, right? A life cycle approach to whole of this process of automated technology must be adopted to understand the impact of it on human and to rationalize, so that human development is the ultimate goal. And here comes the most important part deals with the ethical principles. Now this will form the crux of many of the answers on ethics, many of the answers on governance and health sector, right? So the most important part of this answer is here. First, protecting human autonomy. Now this answer will reflect not only AI use in health sector, but artificial intelligence, big data, analytics everywhere, right? So autonomy of human beings cannot be invaded. So this is the first principle we have to follow. Human being, well-being and safety, this has to be taken care of in the beginning. No machine can harm human health, right? Third one, transparency and explainability. Now every machine will have to explain what it has done and how it has done. It has to be transparent. It cannot be such that machines are concluding a lot of facts and they are acting by themselves. They have to be under human control. Fourth one is taking responsibility and accountability. Now, all the organizations which are applying this technology must take responsibility, chief responsibility for this, for the activism of machines, right? Inclusiveness and equity. Now, if this technology is available only in urban sectors, then this is not inclusive. If this is available only to the developed countries, again, not inclusive, not equitable, right? So therefore, we must have this principle as well activated. And responsive and sustainable. So we cannot have this technology running for only a few years. It has to be sustainable. It has to be something which forms a part of our circular economy. So these principles form the bedrock of using of artificial intelligence, right? So this is what this debate is about. Now, all All is required is to make the stakeholders responsible. All is required to have a liability regime for all the stakeholders, especially the people who are giving services, so that in case there is some issue in delivering services, right, so then they are liable. They also provide for curing the issues that have cropped up, right? So after having understood this article, let me bring you to a very important topic, which is about the 3 laws of robotics. Now, artificial intelligence also deals with robotics. So Asimov, an important man during the age of 20th century, in 1942, he declared 3 laws of robotics. Now, what are they? The first law says that a robot must not injure human being through inaction as well, right? So they must not injure human beings. The second one says that a robot must obey all the orders given to human, right, except when they are in conflict with the first law, right? So they must obey all the orders apart from the order asking to injure a human being, right? The third law says the robot must protect their own existence, right, as long as first and second law are not in conflict. So to protect the human, they must not injure human, they must protect human, and they must obey orders, and they cannot obey order if first and second law are in violation, right? So these were the 3 laws, and artificial intelligence also have to work on these principles, right? They cannot work on injuring a human being, right? They have to follow the orders. So these are the basic principles. Later movies also got formed on these laws only, but they are also utilized in the current day, and these can be asked in the pre-exam as well. Also, we had a 0th law later. The 0th law spoke of the 0th law spoke about humanity. It says that robot may not harm humanity as well, right? Or by inaction allow humanity to come to harm. So it is not just about humans, but humanity as well, right? Some evolution in the 3 laws through the 4th law, through the 0th law. Okay. Now, after having understood the various aspects to use of artificial intelligence in health technology, you should try to attend this question. Analyze the ethical challenges. The ethical challenges with reference to the use of artificial intelligence in health technology, health sector. So direct question, analyze the ethical challenges, right? And then highlight the principles which can guide this sector beyond the challenges. So we discuss right on the topic. What you got to do is take 1 minute of thinking of how this technology is aiding. So we discussed individual, right, resource development, and collective way, public health, right? After that, we understood what are the challenges. We discussed various kind of challenges, like for example, the employment challenge, autonomy challenge, irreplaceability challenge. And after that, we discussed principles, ethical principles under which all these machines should be working, right? So take a minute off to think about this, note down the keywords, and attempt this question, right? If there are feedbacks, you please put them on comments. If you like the video, please put a thumbs up. If you want some certain topics to be discussed in future section, do share with us. Thank you for watching.